So we're talking about hip rotation, and we're going to do some positional isometrics for the hip. And so the hip can externally rotate or internally rotate. And so internal rotation of the hip a lot of times is a position that we're trying to improve. And so as we try to improve it, there may be portions of or positions that we're trying to strengthen isometrically. And so a general rule is that we start in a more neutral position and then work our way out towards the ends. And so in this position, there's a couple ways we can do it. We can have patients start sitting, use band resistance, using kind of an anchor between the knees, and then drive out into internal rotation. And so fairly neutral, and then hold this isometric position for time. As people improve, we then go further and further out towards end ranges. And so a common position that we'll get in is this kind of 90-90 or shin box position, or we can go into more of the sitting position and internally rotate. So if we pick one of those positions where we internally rotate, and now a beginner, we can use some blocks to kind of find more of that bottom portion. Once we get to that bottom portion, we can drive into the block to further push into internal rotation, or we can kind of lift up the foot and hold to work on an internal rotation isometric. If you choose this method, you can use some resistance here, and so we can use the cuff weight would work well here to create some tension, hold that isometric in this position. The other option that you have is to then work on external rotation isometric in this position. And so we can either drive further into internal rotation, driving our knee in or lifting our foot in, or we can work on external rotation. External rotation would require that you have some kind of resistance here. And so, we might use something like a ball and push up against that ball, a weighted ball, or we can use a self, pressure. So I'm pushing down into that ball and trying to lift my knee into it, a combination of the two. Some people will use kettlebells, drive the kettlebell on their knee and push up against it. And so whatever you choose to create that isometric, just understand that once you get into a position, you're going to drive away and you're going to drive towards. And there's time frames that we'll use to do this, ramping procedures where we progressively push harder into it. We describe those in other places in our videos. And so this is just to give you a few ideas of how you can put your hip into internal rotation in certain positions. Another potential way that you can do it is, again, standing. And if we switch the camera angle here, drive up into a position with our knee and then internally rotate. And the same way that we just did it in that sitting position, I can create some kind of resistance to pull me back either into neutral or something that I have to push up further into internal rotation.